So a great welcome to all of you who are watching this show of Heartfulness Wellness. And another great webinar is in the offing today. We have two wonderful speakers alongside with Abhirami, who is our program coordinator, and I, the host, Dr. Snehal Deshpande. I think many of you must be knowing me by now. I still introduce myself as a developmental therapist and a CME director, and also I look at the wellness. I'm a subject lead for the wellness programs of Heartfulness. So, welcome to this episode on nurture and care, which is completely dedicated to our sisters, friends, mothers, all the women whom you know, a dedicated show for women. So on show we have our beautiful women, Dr. Snigdha Mehta and Dr. Neeta Singh, who will be joining us in a couple of minutes. So being a man or a woman has a significant impact on health as a result of both biological and gender related differences. Now, what we see is that the health of our dear sisters, mothers, friends are completely a concern because of lot of changes biologically which happen in the body of a woman right from puberty right until her menopause. So we are here to discuss the most delicate age. Of course, problems exist at all ages, but we are here to discuss at middle age where the woman has to work, if she's on the threshold of getting married or is married, she wants children and maybe sometimes she's late to conceive, and then there is a plethora of problems which also develops with that. So heartfulness wellness has a good amount of programs which is dedicated to families, and we start from relationships, which is wow to wow. I will get back to that a little bit later. So to introduce our dear friends, my dearest friend, Dr. Snigdha Mehta. She's a physiotherapist who is from Mumbai, and she's certified in obstetric and pelvic health physiotherapy with the American Physical Therapy Association, and is a faculty for their course in India. She has also been trained in musculoskeletal physiotherapy. She has also looked at, she's a pioneer of physiotherapy from USA, UK, Australia, Europe, New Zealand, and South Africa. She provides, so we have all been trained by her. I'm also trained by her, so I'm a developmental therapist. I'm proud to be one of her students in the last workshop she conducted. She provides advanced training in women's health physiotherapy to physiotherapists across the globe and conducts seminars, webinars, and physiotherapy camps for NGOs. She owns and leads her own physiotherapy center in Juhu, Mumbai. She has won a lot of recognitions, and she has been leading. She has been the chairperson, the president of Physiotherapy Private Practitioners Group or Association. She has been one of the founder members of Society of Indian Physiotherapists, which is dedicated to clinical and academic excellence in practice. She has been the ex-president of Physiotherapy Private Practitioners Association. And my second dear friend is Dr. who will be joining us in a few minutes is Dr. Neeta Singh, who is a senior professor in the Department of Obstetrics and Gynecology at AIIMS, New Delhi. She's a professor in charge, Division of Reproductive Medicine and IVF. Her main area of interest in reproductive medicine, IVF and infertility. She produced the first IVF baby of AIIMS, New Delhi. She has received many national, international awards and honors, a prolific researcher, and has published more than 160 papers in national and international journals. She has contributed more than 25 chapters in textbooks on various aspects of infertility. She is a member of many professional and international bodies and is invited world over for her guest lectures. So, as Neeta joins us, we will be also involving her. She has a little bit of an emergency situation at home. So, till that time, we continue our conversation with Dr. Snigdha. So, hi, Dr. Snigdha. How do you feel today?
Very good. Excellent to be with all of you.
Wonderful. So
Couldn't
I
be better.
really thank you. Hi, Abhirami. It's nice to have you on the show too. And
Namaste.
namaste. So when you look at women's health, Snigdha, it is a very niche area and a niche field of practice. How come you chose this field? And why? What drove you? What was the inspiration to choose women's health?
Um, I think I chose it long before I even got married. So, as a fresh graduate from college, physiotherapy college, I was inspired by a very senior physiotherapist who had been trained in London, and she inspired me to look at women's health in a very different perspective. The pregnant women, how can we help them in the labor? How can we make them more fit? How can we help them in the postpartum period? So this was all very new for a fresh graduate like me, and I got very intrigued and interested, and that's when my journey began. And after that, I haven't looked back. I have enjoyed this journey a lot.
Thank you, Snigdha. So, what type of patients or clients approach you? Do they really approach you? Because women's health is women don't look after their health, number one. And even the
True.
people around her feel, even if they try to tell her, she feels like I come the last in the row of families. So do you really have women approaching you? And if they approach you, it is for what reasons? Snigdha, are you there? Snigdha, I think she's muted. Abhirami.
Yes, yeah. Dr. Snigdha. Dr. Snigdha, can you hear us? You're on mute.
Snigdha, you're on mute. Can you unmute yourself?
Yeah, yeah. Okay. Now, now is that
Yeah,
better?
yeah, yes, yes.
Okay, okay, okay. So, uh, so, uh, so yes. Well, I started with as I said, I was inspired by this very senior physiotherapist who had been trained in London, and she used to have the exercise classes for the pregnant women. Um, and initially, when I talked to the doctors, the gynecologists, they were not very sort of gung ho about sending their pregnant women, maybe a little afraid to make them exercise. Mm. But what happened was that once I started getting these girls coming in by themselves, they were very excited about doing exercises, and the bonhomie that they've created amongst themselves, the emotional and the psychological support beside the physical support they got from each other. I think then they used to go and tell the gynecologist, please, we want to go to Snitha. We want to do the exercises. So it became the other way around. In fact, the girls, in fact, inspired the doctors and gave them the confidence to come, and then that's it. That's how it started.
So
Yeah,
that's very exciting to hear that exercise and that too for women because
yeah,
during our time, Snigdha, things are very different. We never considered pregnancy to be in a phase where we have to stop everything and take a bed rest and maybe say that okay, I cannot
yes,
come to office anymore. But nowadays, when I see
right.
any girl who's getting pregnant, the first thing she'll tell me is the gynecologist has told me to take bed rest. So, how can we justify this? And do you think that bed rest is essential for every woman who's getting pregnant?
Uh, I agree that often bed rest is a little overdone, but then also gynecologists have their reasons for because they do not want anything to go wrong. They want to be extra careful, and so do the girls want to be extra careful. But in the advanced courses that I've done for pregnancy and postpartum, we've learned a lot of things that they can do with during bed rest also. So that's a field that is not very well exploited as yet, because when a girl is on bed rest, she is herself afraid to do exercises, and so is her doctor. But depends on the level of the bed rest she needs to take. Some have to be absolutely on the bed, and they probably will end up having a miscarriage if they move. So those are the girls there are absolute contraindications for exercise. But there are other girls who can do some exercises and actually they feel much better, because also bed rest, beside physically going down, they also mentally go down. It's horrible to be on the bed like that for weeks and weeks. So I do a lot of online work for these girls who are on bed rest, and that the pandemic has taught us a lot of good things. One of them is the online facility, like we are doing right now.
Yes, I think the online has brought the world closer, has brought all of us closer. Needless to say, we lack physical activity and we lack the physical connect. I miss that. I miss, like when the workshop I did with you, Sigdha, I really miss being
Yeah,
with you in your beautiful clinic that you have
yeah,
in Mumbai, in Juhu. So, coming to my next question to you, what kind of exercises do you think are important for females? And are more exercises equal? More exercises, so some women don't do exercises and there's another set of women who go on doing exercises. So do you
right,
think that, I mean, I'm also a fanatic of exercises, I'm a
yeah,
gym fanatic, so does it mean
right.
more exercises, more health?
So, no, that's not true at all. So, the exercise, of course, has tremendous benefit. Every system of the body functions better when you're doing exercise in the right amount. And exercises are mainly of three types that all of us need to do. One is the aerobic, the cardiovascular exercise to pump up the heart rate. And then, of course, are the stretching exercise, which are equally important, and then the strengthening exercises. So, all these three categories of exercise should be done by all of us at every age. As we grow older, we need more of strength training, because our muscles, we go into what is called sarcopenia, and also our bones start becoming weaker. So as we age, we really need more strength training exercise. Of course, aerobic and stretching exercise are important, but strength training become even more important, because the bones lose their density and the muscles lose their girth, and then we feel the strength, our overall strength diminishes. Now, let me tell you about over exercise. Yes, we get a lot of pregnant girls often who are athletes. Now, what they cannot not stop, they cannot stop exercising. They want to do all of it the way they were doing earlier. Now, over exercise is as problematic as no exercise or under exercise. Over exercise can affect the joints. They can cause degenerative changes in the joint. They can affect the muscles, torn muscles. They can affect the bones. They can affect the heart, the blood vessels, the calcification. It is known, research shows that the calcification in athletes who are at a doing very high level exercise could be more than somebody who was doing optimum exercise. So over exercise also makes them immunity less, so they are more vulnerable to having infections. Also, the hormonal balance goes for a toss when they are over exercises. Many of these high level athletes don't get their periods regularly. They go into what we call amenorrhea, or no periods at all, or very little blood during the period time. So there are a lot of effects that over exercise causes. Now, girls ask me, what do you mean by over exercise? And which I completely understand. What is the meaning of over exercise? So it could be different for different people. But if you feel extremely exhausted when you do the exercise and you don't feel the good feeling that normally with the endorphin release that you should feel, then I would say that would be over exercise for you. So over exercise can be as harmful as under exercise, and so optimum is important. The rule is usually 150 hours of exercise in a week. spread with these three kinds of exercise. But even that 150 hours of exercises, continuous jumping, running, those, then it can still be an over exercise. So you're muted, Snehal, you're
Sorry.
muted. Yeah.
So you say this is exercise is very important and 150 hours of exercise. But when I even used to tell my mother about exercises, or I tell any of the other friends who are not into any sort of active profession, that they always say, "Oh, we do our work. We get up in the morning at 5 and we continue till night and we are working, and that's exercise." Do you believe that that's exercise, or do you feel that they also need to take care of their health?
So, yes and no. Yes, it is exercise because there's something called NEAT, NEAT, non-activity exercise thermogenesis. So that's extremely important too. So in the olden days, women used to do, or women, men, everybody used to do so much more physical activity. Like in India, they would, do the wheel where they are grinding the atta. They would go to the farm. They would do the work, so that's non-exercise activity. So non-exercise activity, if it's a lot of physical, then yes. In fact, now for us, NEAT is going down a lot for all of us because we are doing everything in a sedentary manner. We are sitting and talking like right now we are, right? So NEAT is going lower and lower, and that's why we need exercise more and more. But when a man came or woman came first on earth, they didn't need, there were no Zumba classes. My grandmother didn't go to any Zumba classes, they didn't go to any exercise classes, but she was extremely fit with 10 children, and she was so fit in the last. So yes, if the NEAT level is very high, but today the older women are not having a high NEAT. Today, our mothers are not having a high NEAT. They are not, so their kitchens are standing. They are looking, doing a lot of sedentary. There are all gadgets that help them. So their NEAT is not very high. Then yes, they require exercise. Also, exercise is very specific. So if I have, so what we physiotherapists do is, as you know, we do what we say preventive physiotherapy. We do a musculoskeletal examination of a person. On the basis of that, we suggest some specific exercise for a particular person that could be different for you, Snehal, or for Abhirami, right? And those exercises are not done in our day-to-day work. So yes and no. So both are equally important.
Wonderful. So, what does a sedentary lifestyle really? How does it affect our health as women? And what is the effect of prolonged sitting? Or maybe, if you have a backache and if you go to some doctor, they always tell you, "Pehle bed rest for 3 weeks." So they put you on the bed directly there. So what is the effect of sedentary lifestyle on your body? Effect on of prolonged sitting? Like
Yeah.
many people are what is that? WFH, work from home, and they keep
Mm.
sitting in front of the laptops. So what is it that you would recommend? What
Yeah.
is it that you would like to say on this?
Right. So something that this pandemic has done to us is, and I'm not even talking of the effects of COVID. I'm talking of the people who have never got COVID or you've had COVID but recovered completely. So this pandemic has made all of us more sedentary. All of us, including, I get a lot of children nowadays with backache, neck pain, shoulder pain, etc., knee pain, because they've been sitting for hours, most probably on the bed with their laptops, and for hours and hours they've had screen time, either because of school or because of entertainment. So many people have been stuck to the screens and stuck to sedentary activities, and that also in terrible postures. They don't have a proper desk and chair. So, or even if they have, when they are attending they can sit in any position, and so the postures are getting affected, and the muscles, our butt muscles, the glutes, are stretched all the time when we sit, and glute muscles are extremely important. When man evolved from the quadruped animal to the biped man, our glutes were the ones that make us stand upright. Whereas when we sit, our glutes, our butt muscles get stretched all the time. And hence, actually, we are going back into our quadruped position. You know, we are always doing like this. So we're almost going back into our quadruped position, and these muscles actually control the whole body. It's amazing how a shoulder patient comes to me and I will work on their glutes. A foot patient comes to me and I would work on their glutes, and it makes them better. So these muscles are so important, and they are going for a toss when you sit so much, and that too in any position and for long periods. And of course, children, their bone health. So by the time you are 20 years old, you reach the peak bone mass. After that, the amount of new bone formed is very little, and it's only a cycle of the bone changing. So it's a big problem, because if the children haven't run, jumped, done tree climbing, those activities are so natural, then so many years later, these are the children, maybe by the time they are in their 30s and 40s or 50s, we will see those changes which we are not even knowing right now because of pandemic. And so bone health also is important. Muscles are, so these are the children also who are coming with backache and all. It's amazing how weak their muscles are. For a child of 10, I mean, you don't expect those muscles to be weak, but that's what's happening now. So yes, sitting can cause problem to every system of the body. Obesity, metabolic syndrome, blood pressure. You see blood pressure now in those in their 20s and early 30s, and diabetes, putting on obesity. All this is happening because of our sedentary lifestyle, and all the more because of the pandemic. So we have
So, do
to,
you feel that this affects the reproductive health of a woman?
yes, it does. It does. Infertility. Infertility is becoming more and more. You see so many infertility. Dr. Neeta is an expert in infertility. 50 years ago, you didn't hear of infertility. Our grandmothers' days, though, there was nothing like, infertility, nor in our mothers' days. But now you see so many girls having infertility because of the lifestyle, many reasons. It's sitting, sleep is such a taken a toss. You sleep late, get up late. It's not, you have to follow the circadian rhythm. So sleep is another factor that's getting affected, and infertility is happening because of that. Stress. So there's always a stress hormone release in the body because of these girls who work for, and they are highly educated girls. They tell me, ma'am, I don't get time to even pee. My workload is so much. You can imagine what is happening to those girls. So, and then they also, many girls are planning late. So that also is another factor for infertility.
Thank you, Snigdha. Abhirami, you want to ask something? You come from the younger generation, as my daughter is also, and you all have a lot of problems with periods and period pain. Do you want to ask some question on that?
Yes, I would love to. Dr. Snigdha, it was very lovely to hear from you. So I have a couple of questions representing young girls. So I would like to know what is endometriosis, and then maybe especially how does it usually present itself in the body?
So there are many girls who suffer from period pain, right? You hear of many girls, and some of them suffer a lot. Right from the time they are teenagers, they start getting period pain, and they are already suffering for 10 years, 12 years, and somehow this endometriosis is not diagnosed in many girls. Not necessarily that everybody has endometriosis, but a high percentage of those who have chronic period pain and abdominal pain do have endometriosis. So what is endometriosis? Endometrium is the lining of the uterus. So it's inside the uterus. There's a lining which is endometrium. Now, this endometrium, this endometrium tissue gets deposited outside the uterus in the pelvic cavity. It could be deposited in the ovaries, in the fallopian tubes, on the our rectum, on a colon, on our bladder. It could be deposited anywhere. So when this happens, the period pain becomes more. These girls also may have signs of constipation. They also have a lot of anxiety, depression. I've had girls, in that just 18 and 13 years old girls screaming when they passing stool. The whole pelvic floor goes into such a spasm that they cannot. They get terrible constipation, and they get terrible period pain too. And as a result, they go into depression. They feel hopelessness. The gold standard for diagnosis, most girls, unfortunately, they are not diagnosed early. So I would say if your period pain is going on for many years, you've taken medication, you've seen gynecologists, then I think we need a little more investigation. The gold standard for investigating endometriosis is a laparoscopy. So on laparoscopy, you can identify those implants, and if they are there, then there are specialist surgeons who are trained in endometriosis only, and they do only that work. And if you should go to such a surgeon and get those implants removed. Now, where is the role of physiotherapy? Because I treat a lot of endometriosis patients, and where do my role come in? So I'm not going to be able to remove those implants with physiotherapy at all. But post-surgery, most of them come to me post-surgery. So post-surgery, what happens is, because of these implants and because of these adhesions inside the pelvic cavity, the musculoskeletal system suffers. So the muscles which around the pelvic area, around the abdominal area, around the hips, around the thighs, around the chest, all of these muscles suffer. And what our role is to rectify and improve those muscles. So the quality of life improves. So only if you do a surgery, sometimes they don't get that quality of life which they would expect, because the muscles have already suffered. So the muscles also have to get better, and then their quality of life becomes much better, and they will not have then the problems that of severe constipation, pain, etc. is relieved quite a bit.
Yeah, thank you. Thank you, Dr. Snigdha. So, as we are talking about this periods pain, so is it okay to, it's very easily available, the painkillers. Is it okay to take painkillers? Or maybe if yes, what can be taken? Or what is a quick remedy, especially for the youngsters
So,
who work day in, day
so
out?
there are some short-term remedies and long-term remedies. So I would first like to talk about the long-term remedies. So there are girls, these are the girls who are getting period pain but have no fibroids, no other endometriosis. They don't have a pathology. So, but they still get the muscles go into spasm every time they have a period, and that is why they get the pain. Now, what happens is, commonly when we get the pain, we become like this, right? We sort of become tinier. We want to cramp up. So these muscles go further into a spasm. So what I recommend is that when they don't have the period, they should first of all be doing good amount of exercise. Some of the exercises are stretching the front, like backward bend, those kind of exercises. Then there are aerobic exercise. Many of them, when they are doing aerobic exercises in the intervening period, they find that during period they are much better. So, and if during the period also they can do mild yoga poses to relieve that spasm, and of course take hot pack, things like that. And as far as medication, I think Dr. Neeta would have been a better person to tell. But there are some medications available. She's coming, I think. Oh, excellent. Yes, speak
She
of her.
had
And
some
she comes.
emergency and she got late,
Yeah,
but
yeah,
we have
yeah.
a
So,
yes,
would she like to
there is
take
a
over the question? Hi.
hi. Hi, Dr. Neeta. Welcome to our
Hi.
show. And that's Dr. Neeta Singh, I've introduced her before, and you stepped in
Thank
just
you.
at the right moment when we are talking
Yeah.
of medicines. We are talking of medicines for pain, period pain, which
Okay.
are recommended short term
Hmm.
and long term. So you can
Okay.
jump into the medical
Yeah.
management of period
Okay.
pain.
Okay. Okay. So the period pains are typically, they're called dysmenorrhea. Am I audible?
Very much.
Yes.
You're good.
Okay. So they're called dysmenorrhea. And the first line treatment of dysmenorrhea is that you can take any non steroidal anti inflammatory drugs. Like you can take simple paracetamol. And if that doesn't work, you can take mefenamic acid. Normally it's called meftal. And if you have like spasmodic dysmenorrhea, then you can take meftal spas. Okay, and these tablets can be taken like twice a day or thrice a day, depending upon how severe is the pain. And it doesn't cause any harm in the short term, but NSAIDs are not recommended to be taken for a very long time, because all of them, they do damage to the kidney and liver. So, no, normally, what happens when the young girls have dysmenorrhea? It is because their cycles are anovulatory. That is the reason for their dysmenorrhea, and it gradually settles down. So, you don't have to take the NSAIDs for a very long time. So, it's a short term treatment. But if you don't respond to the NSAIDs, then you should go and seek a medical advice, and you should seek a doctor, because sometimes it is the beginning of a disease called endometriosis, and that has to be managed differently, because for that NSAIDs may not work, and the doctor may have to give you drugs wherein instead of having monthly periods, you can have just 3 periods in a year, so that the progression of the disease can be halted. So any other question?
Yeah, we were waiting for you. And yes, just
Okay.
before I come to you, I would like to
Okay.
ask Snigdha, what
Yes.
are the effects of on the musculoskeletal system because of the woman being a lot on the devices? So I always see the young mothers and even the young girls a lot on their mobiles and devices. So do you think, do you get
Yeah.
any
So
cases with
yeah, yeah, yeah,
musculoskeletal
yeah,
issues?
yeah. So yes, usually we look down, so we get neck problem. Usually you're holding the device in your hand, so you can get shoulder problem. We're getting a lot of fingers and thumb problem because of the texting that is being done. And so these are the most common problems that we are seeing because of texting and because of the laptop. Again, when you are sitting, you are working, you're getting those same problems of the gluteal muscles, the knee joints, the ankle joints all start suffering because of. So what happens is when you are in one position for long, whatever the position is, it's like I keep my finger like this, I'll get much more pain. If somebody says for 1 hour you can't move, you have to keep the finger like this, I'll get much more pain. But if somebody says, okay, for 1 hour you can move the finger, no problem. So when we are in one fixed position for a long time, our musculoskeletal system suffers. And that's what's happening to all of us, because our work is such that we are not moving as much as those women of yesteryear who did everything with movement. They kept moving all the time. So yes.
It's not only about the fingers, Snigdha. I can say it's about the mind as well. Their
Yes.
minds seem to be coming to a standstill, and the amount of anxiety, depression, stress affects a woman more nowadays because of immobility.
Yes.
I do see a lot of
Yes. Yes.
young mothers who walk into my center with their kids, and the first thing I tell them before looking even at the child, I said, before you really look at your baby and you want me to give anything to your baby, I want you to work on yourself. So, working on a woman's health and working on her psyche also becomes important because most of them are not into themselves, they are more into the devices. So that's where we bring in our heartfulness program. So we give them relaxation techniques, etc., etc. So, Dr. Neeta, a big welcome to you.
Sorry to
And
interrupt you. Just 1 minute, Sen. We were talking about endometriosis, and Dr. Neeta rightly said that it's a disease that's detected very late for a lot of people. And what I found was is that the day one that they come to me, I only make them do relaxation and breathing, and it helps them a lot. Like Snehal, you said that the mind is so entwined in the disease that we really are not able to separate it out. And therefore, the working on their mind is the first thing that actually helps them to then start recovering. Yeah, sorry to interrupt you.
thank you. That was a valuable piece of advice, Nigdan.
Mm,
I think it was very justified for this
mm.
question. And Dr. Neeta, you are
Yes.
in the profession and you're looking at a wide spectrum, women coming to you from a wide spectrum of society. What brings them to you other than getting pregnant? What are the other problems which a woman comes to you with?
So these days, I would say that there is an epidemic of infertility. And you will see that the site that you see that in India, you find people everywhere, lots of people. It's the end of high fertility for the country, and it will arrive very soon. We will have very changed demography. The population dynamics are going to change. And this is not my data. If you all see that National Family Health Survey data 2021, which is released very recently, end of the year, shows that our urban fertility rates have dropped down to 1.6, and for replacement we need 2.3. So replacement fertility is that we need to reduce the number of children required to balance the people who are dying. So, and the total fertility rate of our country has gone down to 2.1. So urban and social both have fallen down, urban and rural, but the more drastic fall is in the urban. And secondly, so I see, it's an epidemic, in a clinic you will see 50 patients and you will find 40 are coming for infertility, maybe for two reasons: because I'm an infertility specialist, so everybody refers me those patients, and secondly, I see epidemic of lifestyle disorders, which are like PCOD and endometriosis. Because of our sedentary lifestyle, the youngsters, they are all the time sticking to the laptop, social media, phones. They are not aware about the external world. They are detached from the realities, and that is making them, it is a vicious cycle. They don't exercise, they eat a lot of junk food, and then they get a disease. And once they get a disease, they are more depressed, they eat more, they put on more weight, they're very conscious of their social image, and they don't want to go out because they don't look as good as the other people. So then, it is very, very important for this young generation, who is the future of our country, to be informed that this is not correct, and this is something which is curable and treatable. It is just a lifestyle disease. So if we talk about polycystic ovarian disease, it can be managed very well by doing certain lifestyle changes, which I'm sure Snigdha ji is going to talk about. And she mentioned about endometriosis. I won't say endometriosis is a lifestyle disorder. It has to do a lot with the fertility. So it is said that if you don't have a child in your womb by 30, then something else is going to come into your womb. Like either you will develop a fibroid or you will develop endometriosis. And endometriosis is directly linked to the number of menstrual cycles you have. So if you produce one child, we know that when you are pregnant, you don't menstruate for 9 months. Then you breastfeed the child, so you don't menstruate for another 6 to 9 months. So almost it is like 2 years you don't menstruate. So diseases like endometriosis don't come early. But if we defer pregnancy and we keep menstruating and we do not consult a doctor, by 30, 32, you will find many of the women who are infertile have endometriosis as one of the cause. So way back 30 years ago, when I was a student in a medical school, we didn't see endometriosis that much. Why? Because we were getting married at a younger age. We were getting into parenthood at a much earlier age. And so these kind of diseases were prevalent only in the Western world. And we would see a one patient maybe once in a 3 or 4 months or 6 months. Sometimes you will find this kind of patient. So everybody would rush to see, oh my God, you found one endometriosis. So it was like that. And now in one day, we see 5 endometriosis patient in single day. So this is the change I'm seeing. So these are those frequent problems for which, and many young girls and adolescents, they do come for dysmenorrhea and puberty menorrhagia, like their bleeding is excessive in amount. For that they come, and all these problems, if they come and seek the advice, can be very well addressed through the therapies, and they would be soon all right. But they have to seek an advice. Should not ignore them that okay, this is fine, I don't have time, I'm busy in my studies. Now they should seek a proper medical advice.
Abhirami, do you want to ask anything?
Yes. Welcome, Dr. Neeta. So,
I
representing,
apologies, Abhirami. First of all, I'm sorry I didn't submit my apology. I got stuck up in the hospital and I was rushing home. I tried logging for my phone, then I got a message, then I need to have a laptop. So I was thinking it's going to take 35 minutes for me to reach home. How will I manage? So one of my students saw me that I'm very troubled. They said, Ma'am, what's the problem? I said, I need a laptop urgently. So I stopped my car. She said, Ma'am, you come back. We have arranged a laptop for you. So then I'm sitting in
Oh,
one of the
nice.
doctor's room and doing this meeting. My sincere
Thank you.
apologies for being
we
late.
are, we are very glad to have you, Dr. Neeta, here. So,
Okay.
yes. Representing youngsters, I have a couple of questions for you.
Okay.
So, as you said, like our bodies keep changing from
Mm-hmm.
puberty till adulthood or something. So, how can we accept ourselves? Maybe physically, there are many changes, mentally, there are many changes. So, there are many kids who are not able to accept the change and cope up with it. So, what do you would like to say for them?
So, as Abhirami has very rightly mentioned, for in a woman's life, there are three transition zones. One is from a child to adolescent, right? So that's the time when you start having periods. That's one transition you see in a female's life. Then from getting period, then she has to get married, and then she begins her reproductive lifespan. That is ranged between 25 to 35. And then as she progresses, reaches 40 plus, like 45, then she undergoes another major change that is called menopause. And that is when she stops having her periods and she enters into a different phase. I would not say it's aging, it's a different transition. And we all should accept it normally. And there are certain hormonal changes will happen with each phase. Like when we start having periods, what happens, like our ovary starts functioning, so we start having periods, so different kind of hormones are released, so our breast starts developing, we start getting a female contour of our body. You see that some girls start getting pimples, some girls start getting little put on weight. So these are hormonal changes and we need to take care of our body differently at each transition zone. So these days, as we say that we don't have to put on weight, so some girls become so, like, they get so so much paranoid about having weight that they become very anorexic. So that's also not very good for them. You need to have maintain an ideal BMI to enter into reproductive age. So women who are very very thin will have problem in conceiving. Women who are very obese will have problem in conceiving. So then you have to maintain an ideal BMI. And for Asian women like us, Indian, it is said that you should have a BMI of less than 25. That is called an ideal BMI. It should be between 19 to 25. 19 is the lower limit and 25. For the other ethnicity, it is little more, because for us it is the cutoffs are lower because of the thrifty gene we have in Indians, which predisposes us for diabetes, and therefore we have to maintain our BMI at a slightly lower limit. And then when you enter a reproductive lifespan, then you have to have some body fat is required for having entering into pregnancy. So otherwise, if you're very very thin, then when you get pregnant, then sometimes you have growth restriction during pregnancy, the babies are smaller in size, so your obstetrician is going to give you different kind of advice. And then at last, when you enter menopause, when your periods are going to stop, then also you will notice different changes, like you become very irritable, suddenly you will start putting on weight, you're not able to sleep properly, sort of see yourself in the mirror and you say, is I'm the same person I used to look 10 years ago? Is something wrong happening with me? It's not. We have to accept that this is the part of human life, that we have to go through these normal transition, and we have to accept it happily, and we try to maintain a good health. That at this age there is very high risk of developing hypertension, diabetes, coronary artery disease, because you will be surprised to know that women who are, when they are menstruating, are 4 times less likely to have heart attack. So it's a dictum, said that women give heart attacks to men, they never have heart attacks. Okay. So in young age, we give heart attacks to men. No, no, we break their heart, and but we must have never heard a young woman dying of heart attack. So it's only men who die. But it is contrary when we enter into menopause. The women are 4 times more likely to die of coronary artery disease than men, because it is the estrogen, the hormone, which protects us from the coronary artery disease or the cardiac events. But when we have menopause, that hormone is no more there, which was protecting us from these diseases. And therefore, we have to make certain changes in our lifestyle, that we don't get heart attacks and coronary artery disease. That is, we have to modify our diet, uh, high fiber, low carbohydrate, high protein diet, to sort of take calcium, exercise regularly, maintain a good posture, and to be always in a positive frame of mind. And I would say that at every stage you set some goal for yourself. When you are young, you want to pursue a career, so you have certain goals, so you're always positively charged that you're doing something. During reproductive age group, beside your career, you have to take care of your children, your husband, your family. So then you have to prepare yourself. And then when you're entering menopause, you should never have that negative image of yours that you're not looking good. You still can do so much good for the society, that you should pick up any good hobby or set up any goal and target for yourself and be able to do good. So I think I'm able to answer everything. If there's anything left, I'm happy to answer.
Yes, 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 you did. We have one last question to you, Dr. Neeta.
Okay.
So there's a saying, very old saying, prevention is better than cure. In that
Mhm.
prevention basis, can you just explain us about PAM spear test and HPV test, and
Okay.
when it has to be done?
Okay, very good question, Abhirami. I congratulate you for this question. So these two tests, Pap smear and HPV. So what is HPV? HPV is human papilloma virus test. So this is also a part of Pap smear test only. It is it is to detect whether you have HPV infection in your cervix or not. So we take a smear from the cervix and we send it for cytology, and the cytology detects that whether, if you do a normal cytology, then report will come that the smear is normal, it doesn't find any abnormal cell. But if you send it for together with pap test or HIV test, the report will come whether you have any positive HPV DNA test or not. So HPV is human papilloma virus DNA. So this test, the same smear, if you write to the pathologist that you want to see the HPV test also, they will detect whether in the smear there is presence of human papilloma virus or not. So what is the significance of this HPV test is because HPV virus predisposes women to cervical cancer. And as you know that cervical cancer is number one gynecological cancer in women. There are two most important killer cancers in women. One is breast cancer and second is cervical cancer. And most of the developed countries have been able to eradicate cervical cancer because of the sort of preventive strategies. And the preventive strategies are that you can get yourself vaccinated for HPV. When you know that the HPV infection predisposes you for cervical cancer, then now the vaccines are available and you can get yourself vaccinated. Now, next question is, when should you get vaccinated? So, the best time to get vaccinated is before the first sexual activity. So, in Western countries, mostly young girls and women aged, 13 and above, they start into sexual activity. So they recommend that by 13 you should get 3 doses of Gardasil, and if you are using another vaccine which is Cervarix, then 2 doses of Cervarix should be taken. But in India, because most of the girls, by 17, 18, they get sexually active. So, you can give the HPV vaccine by 17 years or 18 years. And this vaccine can be taken up to 35 years. It doesn't work beyond 30, 35, because it is said that when the sexual activity has already started, like you're married, so if the infection has already come into the cervix, then the vaccination is not going to prevent. So it's a preventive strategy. So there is a massive movement going into the country to vaccinate all the schoolgirls to the HPV vaccination. It might come into the national vaccination program soon. So mostly in the schools, we are making the children and the parents aware that if you have a girl child, vaccinate her for HPV. And then once you are vaccinated, then the pap test should be done starting from 35 years. That you should get the pap test done every 3 years, up to 45 years, and after 45 years annually you should have pap smear test. And if you have three pap smear test negative, then you can do a pap test every 5 years. So both the tests are same test, HPV DNA and the pap test. They are taken through a cervical smear, and they are like preventive strategy for cervical cancer.
So I think you really answered this question very well. And I was going to ask you, what are the investigations essential for women? This was the first webinar for women through Heartfulness Wellness, and we look forward to both of you being the part of. We'll go through the lifestyles, like we'll have the younger generation whom we really want to uh, come with when there are a lot of questions unsaid, unleft, and unanswered. Like one of the most, and which is very sensitive question, is women get scared of sex, some of the girls, and it becomes a painful procedure for many of them. So would any of you like to comment on this? Because I think that's a topic which is not dealt, and not, it's sort of kept aside and said, okay, let's minus it. So any of you want to take this up?
Let Dr. Neeta speak, then I'll speak.
Okay. So, Snehal very rightly said that this painful intercourse, it's also known as vaginismus in the scientific terminology. So, we used to see a lot of problems of vaginismus earlier, and still we get patients because it's more to do with the psychology of the patient. that she doesn't allow anyone, either she has some negative, some kind of negative, feelings associated with this act, or she has had some bad experience in the childhood that she doesn't allow, or she feels severe pain during the intercourse. But when the girls come, or the married couple comes with this problem of, obviously when they are not able to consummate the marriage or able to do the intercourse, obviously it will result in involuntary childlessness. So when the couple comes, we obviously take the history, that are you able to stay together, how often you are doing the intercourse. And then when they give the history, the doctor, she doesn't allow me to even touch her, then we sometimes have to counsel the girl, and we have to really tell her that, sometimes it's very hypersensitive. Even if you touch her, she will, get very jittery, that she wouldn't allow you to do any examination. And then you understand that it is more of a psychological problem, and we deal it differently. And it is not a very difficult situation to handle, and most of the time we are able to handle the situation by counseling and by gradual therapies. Dr. Snigdha wanted to say,
Yeah.
add on
Yeah.
something.
So yes, we do see these young women who have problems with intercourse, and so we teach them exercises. Now you've heard of Kegel exercise, but Kegel exercises mainly we talk about tightening the pelvic floor. Here we teach them to relax the pelvic floor, and we do a external examination. We do not do an internal examination at all, because these are the girls who will react to a specular, even a gynec, you all, when Dr. Neeta would examine, they would not allow, the examination. They would not be able to use tampons. So these are the typical girls who have a very tight pelvic floor, and they make it go into spasm if anything is brought near the pelvic floor. So we teach them how to, with breathing and with diaphragmatic techniques, we teach them how to relax the pelvic floor. And then, of course, we teach them how to use dilators. Dilators are sort of, if they mimic the penis, but they are, so there are grades in that. We start with the minimum thickness of the dilator, and we also do a lot of other manual therapy techniques for muscles that are attached to the pelvic floor, so that sometimes you have the piriformis or the obturator internus tight, or the coccygeus muscle is tight. So we sort of work on them and help them to, and the results. And of course, it's a lot to do with the mind also. So it's both a physical and a psychological treatment that helps them. And most of them do well. Sometimes they have a pathology because of which they have the vaginismus. And of course, then we have to deal with the pathology also.
Thank you.
This is
Thanks to both of
very
you.
well, but
And
yeah.
we would get back with a series of programs for women at various ages and stages, so that we can handhold each of the groups individually to what they want. Meanwhile, I would like to suggest that we have a lot of programs, and Dr. Neeta and Dr. Snigdha are already a part of our programs, which are on relationship, which are on fertility enablement, and further on. So we request, if any of you would like to participate, kindly connect with us. We will be setting the slide right in the end of this program. There's one question and one correction, clarification. I think one is on periods pain, which is lasting for the first day alone. Sometimes the bleeding is not very good, and suddenly there is an increased flow. So, how does one deal? When should they approach a gynecologist, and what should they do about this irregular periods or extra period flow and pain?
Snehal, this question is also very commonly, often girls and adolescents come to with this problem. So irregularity means, the period the frequency can range between 24 to 34 days. If the periods are coming between 24 to 32 or 33 days, it is very normal. So every month, it is not necessary that your period is going to come on the same day which you had it in your previous cycle. So normal variation of about 4 to 5 days is normal. So it is not called irregular periods unless that your cycles become shorter than 24 days. Secondly, regarding the flow, so the duration, normal duration of the menstruation is described between 5 to 6 days. It's average like 4 to 6 days. And if it is lesser than 4 days and more than 6 days, it is abnormal. Regarding the proper flow, some women may feel that there is, little spotting on the first day followed by a proper flow. That is also normal. But if you keep on having spotting after 6 days when your period should have finished, then you need to seek a medical advice, and the doctor is going to do an ultrasound and see if do you have any fibroid sitting in your womb, or you have any polyp which is causing post menstrual spotting. But in between 4 to 6 days, if it is first day you are spotting and second day the proper flow, that is pretty normal. And sometimes you have dysmenorrhea in the initial bit, like before the period is going to come, you have very severe pain and congestion, and you feel very abnormal. That is also very very normal, because that's the time, the pelvic veins are very congested, because the period is about to come. So then you start feeling very heavy in your lower abdomen, and because of the buildup of a proper hormone which is called progesterone, there is retention of fluid in the body, so you feel very bloated also. And as your periods come, then you feel okay, you feel lighter, and all the fluid retention which was there has gone. So this is a normal part of the hormonal cycle of a woman. So it's not abnormal. But if you feel anything is exaggerated than normal, then you definitely should seek a medical advice.
Thank you. Thank you. And one last clarification, Snigdha, I think it was 150 minutes, right? Not hours in a week. So that is one clarification someone was asking per week, the frequency
Sorry,
of
I didn't
period.
get the question.
So the
Can you tell me?
clarification was asked by someone that you mentioned 150 hours or 150 minutes per week.
Minutes. Minutes per
So that
week.
was, yeah, okay. So that was the
Yeah.
clarification. And with a note that we would come back with a lot of other issues like hyperprolactinemia and hypothyroidism, which are common problems which we see today in women. And there have been also demands for this program to come into Hindi. So let's see how we can manage that. But till then, I wish all our viewers a great weekend ahead. And please join us on our weekly meditation sessions, and the email address which we would look for, which we want to give you, is going to be put on the slide now. Thank you for being with us.
Thank you so much.
Thank you. Thank you so much. Yeah. Thank you, Dr. Neeta. It was wonderful to have you too.
Yeah, sure. Thank you, Dr. Snigdha and Dr. Snehal and Abhi.
Thank you. Thank you
Yeah,
so much.
Nehal, of course. We are wonderful organizers.